for it. It's a little easier these days with the help of plastic surgery, maybe a little bit, more than a little bit easier anyway. Especially when it comes to getting rid of dreaded double chins and sagging cheeks.
It really is dreaded, I'll tell you. Dr. George Marosan with Bellevue Plastic Surgeons explains a neck lift can take years off of your look, while neck liposuction can make you look pounds and pounds lighter. The right procedure depends upon your age and your skin tone.
Yeah, and check out these results here. What an amazing difference. This is Magdalena's before and after neck liposuction to remove extra fat underneath her chin. She looks like a whole new person there on the right, doesn't she?
Sure does. That is great, doctor. All she had done now is liposuction only. We need to know here, who's a good candidate for that?
She is, because she has good skin.
Yeah, that looks great.
There's no loose skin or wrinkles in her neck. She has good elasticity to her skin. So I expect that skin to tighten up once you empty the fat. So really, she doesn't have excess skin, because that skin that's bulging out now has to kind of lay in there, so and tighten up.
But what about ages? If you could tie an age to it, is it a certain age group that might be a better candidate?
From 20s to maybe 40s. 50s, depending on genetics. You know, some people do hold up better than others.
Yes, they do.
Sun damage can cause a lot of aging to your skin, a lot of loss of elasticity, and those are much more difficult to work with.
Okay, so younger looking skin is better for that, so you can still fill
and
it out.
That was Magdalena?
Magdalena, right.
Guess what? We have Magdalena on the telephone right now. Can you hear us, Magdalena?
Yes, I am hearing you.
That's an incredible before and after. You had this surgery 5 years ago now. A lot of people are wondering, you know, is it still holding up?
Of course, it's still looking great, and I think it was the best things I did for myself. I had double chin after my mom, and I didn't like myself, especially was more visible on the pictures taken from my profile. And I decided to do something about it, and I did the best things in my life.
Well, you look fantastic. Is it something that you would recommend to other people?
Of course, you know, I think it just takes the years, and you feel much younger, and you look better. And I refer even to my best friend, to Dr. Marosan, and he did the same procedure on her.
Did it hurt at all, Magdalena?
Excuse me?
Did it hurt at all?
You know, I decided to go under general anesthesia, so I didn't feel any pain during the procedure. But I experienced a little swelling and soreness for a week after that, and I was wearing compressive garment on treated area.
Yeah.
So I felt a little discomfort only during the healing process.
Well, it looks great.
Yeah, Doc, speaking about that, what's the recovery time on a surgery like that?
Well, the initial recovery is probably about a week to 10 days, but really it takes up to even 3 months to get full sensation back to the area and not feel a little bit numb. Actually, this photo that I got of her after, this is 5 years after. So she's still maintaining.
Wow.
She's still maintaining, you know.
Wow.
How long does it last then?
Well, if you maintain your weight,
He's looking at me. He knows.
it will last. Now, again, you know, over time, you know, probably the next 10 years or so, she might end up with a bit of looseness of the skin. As we all age, we do develop a little bit of looseness of the skin. And then, you know, the other ways of dealing with that. So,
Let's talk about neck lifts. Here's another thing that people can do. Let's take a look at this photo and another incredible before and after. You see what the left obviously is the before and the right is the after.
Oh,
what can
wow.
people get done on those necks? I know a lot of people, you know, I from time to time have those the turkey neck going, you know?
well, like this lady, she's in her mid-50s, late 50s, and she came in really for neck liposuction, but her problem is not a lot of fat in her neck. She has a little bit, but it's mainly loose skin, and the muscle loosens up. You see the muscle bands, you know, they become loose with age, and so she really needed surgical involvement, a little incision under the chin, and then a little bit behind the ear, you know, to.
It's fascinating. You can't even tell that she's had surgery. In fact, Ann's admiring the surgery over here. You have a question for him.
Yes, doctor. What are the risks associated with this kind of surgery?
Well, risks are minimal, but it's surgery, so there are nerves that you need to preserve and not damage, so you won't have permanent numbness. And again, you have to make sure that you're not going to make it too tight, because that will look not natural, and also will tend to create thicker scars, you know, at your incisions if you make it
Well, you
too
can't
tight.
even
So,
see any trace
the
marks
other
of a surgery
potential
there.
problem is if you suspend everything to the earlobe sometimes tends to be dragged down. It's what's called a pixie ear. So you try to leave that free and suspend everything behind the ear.
good.
Yeah, doctor, what
not
about
to pull.
cheeks? You want to get the jowls removed. You do that as well, correct? A lot
Well-
of people come in for that?
Right. I mean, neck lift helps the jowls a little bit, but you know, to really enhance somebody's cheeks, somebody has a little bit flat. If you look in the three-quarter view, she has fairly flat cheeks, and just bringing her own tissues up there, and that is a suture suspension deep. I do it intraorally through the incision above the teeth, and right at the bone level, and the tissues are lifted. And there's a little incision because you also did a little bit of a brow lift on her. It's kind of hard to see, but you know the brow is a little bit more elevated, more
it is.
shaped.
What's the recovery time?
That takes a little bit longer for the numbness to go away. They get some numbness of the upper lip, and that can be 4-6 weeks.
Okay.
You know, but sometimes a little bit longer. But
A long vacation, right?
Qualifications for plastic surgeons, very important though, right?
Absolutely.
So make sure they're
Yes,
board certified. Thank you so much,
Thank
Doctor.
you.
You're welcome.
Helpful. We'll be right back.
Okay.